secret for many years that the United States has the most expensive healthcare and yet some of the lowest quality healthcare in the developed world.
That it is immoral, that it is wrong, cut healthcare for low-income Americans, for children, and for the elderly, and give tax breaks to the very richest people.
And healthcare, which is more than 17% of the U.S. GDP.
For some plans will increase next year.
The prices of drugs very high.
Inflation is impacting healthcare.
Health plans, there is sticker shock across the country.
Healthcare costs.
Healthcare spending.
Health costs.
Healthcare.
Medicare.
Medical. Medicaid. Health.
It is 4:25 a.m.
Greetings. Welcome.
Thank you.
We're glad you're here.
Okay, we're about to start handing out tickets, so please get in your seats.
Dental, very expensive. I did it last year. I didn't finish everything, so it's free here.
For the medical? Free dental is my number one reason. Even if with insurance, dental is very expensive. And I have a tooth that might need to be pulled or extracted, and so this will get it taken care of.
Even though I need vision, I'm just going to wait to see how much it is with my Medicare.
Good morning.
We have a 5 a.m. check-in time for the first shifts of volunteers that include both general support and a lot of nurses. And it's really about getting the first part of the process staffed. So down there, patient intake nurses will start getting trained. Up here at patient registration, they'll start training them on the patient registration system.
Once you turn on your computer, this is what you'll see.
The interpreters will be here and they'll start getting trained on their process to prepare for us to open doors at 6:30.
Ladies and gentlemen, we are about to open the doors. Are we good? Here we go.
¿Cuántos años ha sido desde que ha visto un dentista?
3, 4. We've handed out 432 of the 550 dental tickets that we have allocated for today. We've handed out 233 of the 300 vision tickets we've allocated for today, and 43 of the medical-only tickets. So we're in good shape. It's 7:09 a.m., so 30 minutes after having started admitting people.
Everything is here, and it's for anybody. You can have a job, you can have insurance, you can have neither of those things. And when you're in here, everybody treats you like you're a person.
Welcome. We're glad you're here.
We want to start off what inspired you to start the SKCC?
Absolutely. So we were here at Seattle Center. We were working on the 50th anniversary of the World's Fair, which actually founded Seattle Center. And one of the topics we were focusing on was global health. And we were trying to find a way to make that topic relevant to the local community. And I happened to see an episode of 60 Minutes that focused on a pop-up clinic in a rural part of the country that offered dental and some vision services. And that got me thinking that we could do something like that here at Seattle Center. It didn't end up happening for the 50th anniversary, but there was an opportunity that presented itself later where the director of Seattle Center had said, if you have any new ideas that you're interested in doing, come share them with me. And so I shared the episode of 60 Minutes with him, and kind of rest is history. The healthcare industry is a challenging one. It's difficult to navigate. It's very complicated. There are a lot of different layers. It's not always logical to the average person, and that's one of the reasons that people come to our clinic. Not only are they struggling to afford some of the care, or some of the care is not covered by their insurance, but it's complicated to navigate. There's a lot of language barriers. Certain services aren't covered by insurance, and it's hard to understand the bills. It's hard to find providers sometimes right now because there are staffing shortages in the healthcare industry. And many of our patients have really talked about how healthcare has started to feel more like a business rather than healthcare, and having that kind of relational experience and somebody who you can really talk to and understand about you as a person and trust your expertise and your own experience. And so that's kind of what we're seeing right now in the industry, is that it's very complicated, and it also is very business minded, and that is something that patients are really noticing and commenting on a lot.
Would you say that you see healthcare, like, do you see these patterns across all of Seattle and King County, or do you see there more like differences in how like healthcare services are distributed, what it's like in different places? Like, do you see differences in that?
There's absolutely disparities in our healthcare system, like there is across our society. You know, people who live in certain zip codes have better access. People who speak certain languages have better access. People who are of certain income levels have better access.
Can you state your name and what grade you're in?
My name is Diego and I'm a junior at Lincoln.
What medical needs do you have?
I have a metabolic disorder called PKU, or phenylketonuria.
And how does this impact your life?
I have to live with a specialized diet and weigh all my food daily and take tons of medication.
What are the costs for everything, you would say?
I don't know exact numbers, but it's pretty expensive with insurance companies and just medical bills in general.
And on that note, how would you describe the interactions you have with the medical industry?
Mostly good. Insurance companies are where it's really the worst, with my mom having to battle insurance companies for hours on the phone to get me the right medicine and stuff that I need.
How would you describe the access, like needs?
My current clinic is based in Oregon, so I'd have to fly or drive there, so it's not exactly close. But I do have virtual meetings with them like once or twice a year, and I visit them every once in a while, like every couple of years or something. I drive down and go see them. So
Yeah, your hopes for the future for the healthcare industry.
Yeah. The same hopes that I had when we started the clinic. Our motto to a certain extent is we would love the healthcare system to be reformed, to be changed, so that we could put this clinic out of business.
cheaper and more available for everyone to have, just so that like everyone's healthy, like as healthy as they can be, and get all the resources they need.
Healthcare becomes much more accessible to everybody, regardless of their background or their income or the language that they speak.
A few proposed solutions for what the future of healthcare could look like if it was accessible and affordable for everyone.
We want everyone to be aware of the healthcare that they have around them, such as the nurse's office and teen health center downstairs. We are so lucky to have this system at Lincoln.
Another solution that we think would benefit the healthcare industry as a whole is if more organizations and programs either donated to things like the SKCC or started their own versions of it in order to make healthcare accessible at a lot more times and places.
We wanted to make this documentary to shine some light on the disparities that the health industry has and spread awareness of what it could look like in the future.